Community assessment prepared by Ugo, Laurel, and Dimitri. Hello, my fellow classmates. The presentation is about community assessment in a rural area with no access to public transportation. Members of the community include retired population, families with children, older people, poor farmers, primary and secondary school children. There is usually a primary and secondary school for children living in these areas, but no higher institution, such as a university. Things they share in common include females being homemakers, males as the breadwinners, and preference for local homegrown foods. There is also low literacy level, living in small houses, being closer to nature, and being technologically challenged, and poverty. Determinants of health in these areas include low income, low educational level, lack of adequate nutrition, and lack of public transportation. Currently, 25% of the population in Duxbury County is older than 65, and it is projected to increase to more than 50% in 25 years. Currently, people are being diagnosed with diabetes, and there is a need for patient education on what diabetes is and how to effectively manage it with changes in lifestyle. The patients in this case are 65 years or older. Age plays a role in how well individuals comprehend, understand, and retain information. It can also play a role on how motivated individuals can be to change their lifestyle, beliefs, and attitude. When people are diagnosed with a new disease, it can create stress and anxiety, which can affect learning and the new changes the individuals have to make to avoid worsening of symptoms. Duxbury County is located in a rural environment with no public transit system because it only has rural roads. It currently has 5 practicing primary care providers, and only one of the providers specializes in geriatric care. The waiting time to see a healthcare provider is from 1 to 3 weeks. The county has a single 54-bed long-term nursing care facility that is located in the northern region. The people would face challenges in getting the care they need because they have limited resources. With no public transportation and a long waiting time, people would experience poor health outcomes. One way people can receive care is through telehealth. Through the use of telehealth, healthcare providers can communicate with patients to know how they are doing and to monitor vital signs such as sugar and blood pressure digitally. Many people who live in rural communities such as Duxbury County do not have access to hospitals and well-equipped clinics to meet their needs. With the anticipation of an increase in elderly population, the county needs more than one geriatric specialist and accessible roads so that the waiting time could be minimized.
When assessing the community, we felt that face-to-face interviews, surveying the community, and observation would help to gather data to assess what interventions are necessary. It is important to gather as much data as possible about the community. It would be beneficial to assess what diabetic patients know about the disease and necessary lifestyle changes, and to ask the elderly or family of the elderly individuals what resources would be helpful. The obtained information would help to decide what interventions are actually necessary. So there's 3 different types of health centers and public health that we're going to talk about in this presentation. The first is specialty care centers, which provide care and teaching to a specific group, such as those with diabetes, adolescent mothers, the geriatric population, those with mental disorders, etc. The second is wellness centers. Wellness centers focus on health promotion, disease prevention, and management of when someone is diagnosed with a disease. This includes education. Many centers provide care such as dental, mental health, and diabetes education. And the third is comprehensive primary health care centers. And in these centers, nurse practitioners and other advanced practice nurses provide outreach, social support, and other public health programs. There is a major need in this community in Duxbury County for care of the elderly, and as there is only one center that specializes in geriatrics in this community, and in the next 25 years, the geriatric population will likely rise to about 50%. Since the population includes many elderly who have chronic illnesses as well as many with diabetes, special healthcare centers would be the primary concern, the first thing that they would want to focus on, such as nursing homes and wellness centers as well that focus on health promotion, prevention, and management of chronic illnesses would also be beneficial for this community. There are many factors to take into consideration when assessing community needs. Duxbury County is limited in resources to meet its aging population. There's a need to educate the community on lifestyle changes needed to prevent complications of diabetes. There's also a need to invest in infrastructure such as building roads and clinics close to the community. There's a need for a diabetic educator to provide clinic hours so that individuals can come and ask questions in person instead of waiting for weeks to see a provider. Long wait times can deter some individuals from obtaining the needed care. The feasibility of building functional clinics will depend on many factors such as funds to run the project, a location that is conducive for the community, and recruitment of employees who will be willing to work in the community. The clinic has to be strategically positioned so that many people will be able to reach it.
The first article that we will discuss is Community-Based Diabetes Screening and Risk Assessment in Rural West Virginia. This is a cross-sectional study designed to assess diabetes risk among 540 individuals from 12 counties using trained extension agents and community organizations in West Virginia. 3 types of data were collected. The first type was the validated 7-item Diabetes Risk Assessment Survey, which included yes and no answers to the questions related to baby weigh more than 9 pounds at birth, sister or brother with diabetes, parent with diabetes, weight is more than listed for height, less than 65 years and get little exercise, day, 45 to 64 years of age, and 65 years or older. The second type included results from hemoglobin A1c tests. The third type included demographic and lifestyle behaviors of participants. Statistical analysis of the data demonstrated that the majority of participants had a family history of diabetes, weight is more than listed for height, lead a sedentary lifestyle, and were older in age, all of which increased their risk for diabetes. In the future, data collected from this assessment could be helpful to plan and manage community-based projects for diabetic patients. The second article that we will discuss today is Community Assessment for Public Health Emergency Response, which is also called CASPER, an innovative emergency management tool in the United States. This program evaluated knowledge of people about disaster management before and after the training to determine effectiveness of the program. According to Chenal and Associates, objective for this project was to demonstrate how inclusion of the Centers for Disease Control and Prevention's Community Assessment for Public Health Emergency Response as a tool in public health preparedness capabilities, national standards for state and local planning can increase public health capacity for emergency response. The table indicates that most participants identified the training program helpful. They also indicated that the presented material was easy to understand. It is very important to present material at the correct literacy level, so students or community members in this case, would understand presented materials. This table indicates significant progress in knowledge before and after the teaching session. The author points out effectiveness of in-person training. In-person training offers opportunities to form common understandings among stakeholders and identify the value of each of their roles throughout the disaster life cycle. Regardless of amazing results, it is important to note that responses from 80% of participants were not documented, which significantly questions accuracy of collected data. The population in the third article includes marginalized community. Objectives are to explore challenges and opportunities associated with conducting mixed methods needs assessment using a transformative paradigm. The transformative paradigm is a research framework that assesses marginalized communities, analyzes reasons for community marginalization. By combining research findings, investigators could determine actions that promote elimination of disparities. Despite the fact that the foundation that performed the study was the largest private funder of non-profit organizations in the community, the staff and board agreed they needed to adjust their strategy if they expected the organization's dollars to impact residents' lives in meaningful ways. The Greenfield Health Foundation community director proposed a voluntary needs assessment study that accessed the voices of low-income residents. When working with marginalized communities, it is important to avoid biased results by being objective and not judgmental to subjects. Community researches take significant amount of time, and lack of trust, which is important for communication and data collection, might be a barrier to communication. Due to lack of trust between researchers and community members, there is a high chance that these subjects will not voice their opinion about concerns of the community members. Therefore, Jackson and Associates decided to involve a person who will be familiar with the community and become a link between evaluators and the subjects. This strategy worked well. A few concepts were shared this week. We discussed healthcare cost and determinant of health, such as social factors, physical environment and genetic makeup. The focus was also on population at risk and population of interest. Population at risk is the vulnerable individuals and families that are financially challenged and do not have means to make ends meet. This population experience healthcare disparity because they either have jobs that do not offer insurance or cannot pay from a pocket. Lack of health insurance makes it hard for people to access healthcare services. This issue creates disparity when it comes to healthcare accessibility. Therefore, individuals and families suffer from burden of diseases. According to Healthy People 2020, health disparities adversely affect groups of people who have systematically experienced greater obstacles to health based on their racial or ethnic group, religion, socioeconomic status, gender, age, mental health, cognitive, sensory, or physical disability, sexual orientation or gender identity, geographic location, or other characteristics historically linked to discrimination or exclusion. Due to high healthcare costs that lead to difficulty in accessing healthcare services, some people will not seek care needed until individuals are experiencing serious health problems such as dyspnea, fluid overload, inability to urinate caused by enlarged prostate and unexplained weight loss. Minorities and individuals and families living in certain geographical locations such as poor neighborhood and remote areas are at increased risk for healthcare disparity due to lack of resources.